Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, we're going to delve into a different topic than we've covered in the past. As you know, our podcast is devoted to covering the full breadth of different topics in functional medicine. And that really means covering all the different conditions and health issues that people deal with. And today, for the first time, we're going to cover an integrative approach to ear, nose, and throat specialties. And in particular, today, we're going to highlight a couple of conditions that are fairly common and are difficult to treat: vertigo and tinnitus, or at least I think they're difficult to treat, or they have been for a lot of people. Vertigo is a sensation that you or the environment around you is moving or spinning. Tinnitus is a ringing or buzzing noise in one or both ears that may be constant or come and go. Both of these are fairly common conditions, with tinnitus or tinnitus, I'm not really sure how to pronounce it, affecting about 15 to 20% of people, and it's especially common in older adults. Here to give us some information about these topics is Dr. Benjamin Asher, who's a board-certified otolaryngologist,
otolaryngologist.
Thank you. A head and neck surgeon, and he's been at the forefront of applying an integrative approach to ear, nose, and throat disorders. Prior to attending medical school, Dr. Asher worked as a full-time meditation teacher. Dr. Asher is focused on identifying the root cause of symptoms and has a specialty in the area of Lyme and tick-borne illnesses. Dr. Asher served as the house physician for the New York City Opera and the New York City Ballet, and he has pioneered the use of IV glutathione for vocal cord polyps as an alternative to steroids or surgery. Dr. Asher, thank you so much for joining us today.
Thanks a lot, Dr. Weitz. I really appreciate you having me.
Excellent. So perhaps you can start by telling us a little bit about yourself and how you found your way to an integrative functional approach to care.
Well, before I went to medical school, I was a meditation teacher. Really, the truth is that I went to medical school because I thought if I became a doctor, people would listen to me and I would get more people to meditate. So,
Are more people meditating?
Not because of me necessarily, but so everybody has their reasons, and when you're young and naive about how life goes. So when I was in medical school, I actually never felt that Western medicine was particularly good at treating chronic illnesses. Right. It was basically good if you had an acute problem or an immediate life-threatening issue. And so I was trying to decide actually between choosing going into a surgical specialty like ENT or going into psychiatry. And my dad, who was a psychiatrist at the time, said, "Oh, don't go into psychiatry." So I listened to him, and I chose ENT because it struck me as something that you could fix things. If something was broken, you could fix it. I didn't really realize at the time how many of the chronic ENT issues have much deeper underlying things going on, and surgery is not the answer for many of them. So in any case, I, over the years, have studied and worked with all kinds of alternative healing modalities. When I was in medical school, there were some chiropractic students that were living right by me, and we used to get together and work on each other and do stuff, and they would teach me some of their chiropractic manipulation, although I don't do that. I was very interested in it. And then later on in my career, I started working with an osteopath and learned cranial osteopathy. And that is a very big part of my practice for the last 26 years.
Oh, interesting. So, there's a lot of topics we could talk about in the ENT area. And, but when we had a brief conversation, you mentioned vertigo and tinnitus. And I think these are two conditions that are fairly common. I know I've certainly seen a lot of patients in practice with these, and I think these would be good topics to highlight. Though I'm okay with the discussion on any topic in the end.
Sure.
So let's start with vertigo.
Okay.
What is vertigo?
Okay, so vertigo is the experience of motion when you're not moving, basically. So, and it can either be you spinning, or it can be the room spinning.
Do those two different distinctions?
Well, people will report it different ways.
Okay.
So when a person comes to see me and they say, I'm dizzy, right, then I'm trying to determine whether it's a problem with the inner ear, whether it's some other reason. And so I always ask people the question, without using the word dizzy, what's your experience?
Right.
And then the people will either say I'm moving. If somebody says, I feel like I'm going to faint or black out, then that's not an inner ear issue. But there are many flavors of you can have disequilibrium or feeling like you don't have balance, and it's not vertigo, but that can be an inner ear symptom. One symptom is called mal de débarquement, where you feel like you're on a boat all the time. So vertigo can happen there are many causes of it.
Well, by the way, what percentage of cases of vertigo do you think are related to inner ear issues?
True vertigo, I'd say the largest percentage of them are.
Okay.
Are an inner ear issue.
70%, 80%?
Yeah, something, at least that amount.
Okay.
Some inner ear issue. Now, so let me just go. So basically the way our balance organ works is the balance is related to the inner ear, and there are two functions of the inner ear. One is hearing and one is balance. And so there is an organ called the vestibular system, and that is what is the balance part of the inner ear. And if you imagine what's going on is that the inner ear is giving the brain like a Morse code signal. And when you're sitting still, both sides, the Morse code signal is the same. When you turn one way or the other, the fluids shift, and then one Morse code on one side speeds up and the other one slows down. The brain reads that difference and it says, oh, I must be moving. And so the brain gives you the experience of motion when you are moving. Now, it can also happen, let's say there's an injury to the inner ear, and then the one side shuts down and isn't giving any signal or speeds up, then the brain reads that and it says, oh, I must be moving. And it gives you the sensation of motion and you're not. That's vertigo. Okay. Now there's another part of the inner ear, which is involved in perception of gravity too. In any case, the most common cause of vertigo is something called benign paroxysmal positional vertigo. And that's where the understanding is. And once again, nobody really knows, because the inner ear is the hardest bone in the body, and it's bone encased in bone. So it's the cochlea, vestibular system is the semicircular canals are encased in the temporal bone. The only way to look at it is for them to be dead. And it's a really big deal to get to it anyhow. So a lot of these things, people don't really, there's no way to know in a live person exactly what's going on. So what happens in the benign paroxysmal positional vertigo, and this is the most common form of vertigo in adults is benign paroxysmal positional vertigo, is there's thought to be a loose crystal in the inner ear. And the loose crystal, then when you move in a certain position, you lay down with your right ear down and your left ear down, all of a sudden there's a little period of latency, and then boom, you're hit with vertigo, and it lasts for a few minutes, but it can be horrible, and it freaks a lot of people out. Happens a lot to elderly people, but can happen to anybody. So the solution to that problem is not to take a medicine, right? That's not what you want to do. The solution to the problem is to actually you can either do what's called an Epley Maneuver, which you can do you can actually look this up online. You can watch a video, but you can see a physical therapist or
I've performed that procedure on patients before.
Right. So an Epley Maneuver is a type of manipulation where you just basically get the crystal to go back to where it belongs, and then the vertigo goes away. So that's the solution there. There's another maneuver called a Seamont Maneuver, which is if the crystal's in a different canal, and you can do both of them. And you can do it at home. You don't have to do this. You don't have to go see somebody. The reason to go see somebody is that most people are so freaked out about the vertigo. They think they're having a stroke, or they think that something terrible is happening to them. It's not. And that will often solve the problem.
When you do that Epley's maneuver, on average, how many times do you see patients having to do it before it actually resolves?
Oh, that's a good question. So,
personally, I haven't seen it to be the magic cure.
Right. So it depends. Usually when I do it on somebody, I probably have to do it 2 or 3 times when I do it. And then and sometimes, I don't know, maybe 50 or 60% of the time, the person is better. But then sometimes I'll tell the person, look, you can do this at home too. The key thing is to get the positioning right. And then that makes a big difference. Having the head extended at the proper degrees. And there's a good animated video online that sort of goes over it very carefully.
Perhaps you could send me the link to that, and I could put that in the show notes.
Oh, okay. I'll do that. I'll try.
Thank you.
Another solution to BPPV is to just get in the positions that make you dizzy 10 times twice a day. Because what happens is the brain, after a period of time, figures out that you're really not moving. And then it figures it out, and it shuts the experience down. It tells you you're not moving, and you realize you're not, and then it doesn't give you the experience of vertigo.
Okay.
So that's not a functional medicine thing, but it is actually not taking a medication. If you take medication in this situation, you will actually prolong your symptoms. Okay, because if you take Antivert or Dramamine or whatever, a medicine that suppresses the vestibular system, if you do that, you will stay dizzy longer. So the best thing is to be dizzy to get over the dizziness.
Okay. and then we have Meniere's disease.
So that's right. So let's go into that, because that's actually, and once again, there was a homeopathic medicine. It was called Vertigo Heal, and the company Heal can't sell in the United States anymore. And I'm trying to remember the name of what they converted it to. It's Cocculus compositum. It is a homeopathic remedy, and it does. It actually, if you have a lot of imbalance, it does actually help sort of support equilibrium. So that is a natural remedy that's helpful. So regarding Meniere syndrome, the Meniere syndrome, the pathological term for that is something called idiopathic endolymphatic hydrops. And what it means is that there's a mixture of inner ear fluids going on between 2 chambers of the inner ear. And it's this rupture of a membrane, and it results in 3 main symptoms: true vertigo, and it's horrible vertigo, and it lasts anywhere from 20 minutes to 18 hours. So if it's like 2 minutes, it's probably not Meniere's disease. If it lasts for 7 days, it's not Meniere's disease. You have a fullness and roaring in the ear, hearing loss, and loud tinnitus. So that's the triad of Meniere's. Nobody really knows what causes Meniere's, except what the treatment is to put people on a low salt diet and a diuretic is what conventionally is done. One of the things in my practice that I do in the area that I live is I test everybody for Lyme disease, because late stage Lyme disease, Lyme is caused by a spirochete. Another organism that is a spirochete is syphilis, and tertiary syphilis, late stage syphilis, will give you endolymphatic hydrops. And so being in the New York area or New England where Lyme is so endemic, and you have the issue in Los Angeles too.
Yeah, I think Lyme is pretty much across the country now.
Right. So people that are having the symptoms, I test everybody for Lyme disease.
Now, testing really for Lyme disease is somewhat problematic.
It is.
So which particular test do you find most effective?
So I always order a Western blot for Lyme, and I order a co-infection panel. So when the ticks bite people, the ticks are carrying more than one organism often. So they carry Borrelia. They also carry Babesia, Bartonella, Ehrlichia, human granulocytic, and Anaplasma. So I test people with a Lyme Western blot, and then I do a co-infection panel.
Is that enough? Because most of the companies that specialize in Lyme tend to include the Western blot and a series of other tests as well.
They do. So part of my one of the restrictions I have when I'm practicing in New York is a lot of tests aren't available for New York State doctors. So
okay.
So we're limited by what we can order.
I see.
But I also am cognizant of people's pocketbooks, and some of the Lyme testing gets incredibly expensive. So even though the commercial labs are not as good as the Lyme labs, if I can establish a diagnosis with a commercial lab where it's covered under a person's insurance, great. And if I still think they have Lyme disease, then I use one of the specialty labs because they do some of the specialty labs do better PCR or other kinds of tests. Is there a specialty lab you like best?
I
wouldn't say that. There are several that I like. I mean, I like the IGeneX lab in California. I like NDL, that's the Medical Diagnostic Lab in New York State. I like the Stony Brook lab in New York State. I like Armin labs in Germany.
Okay.
They're all good labs for Lyme. But I'd say the largest percent of the time I can use a commercial lab and figure out what I need to do. I will, this is such I kind of got into the Lyme thing through the back door. Like, why would an ENT be doing Lyme? But I had a patient who had non-serviceable hearing in one ear, is basically deaf in one ear, and he had Meniere spells, and he had Lyme disease, which had been inadequately treated. So he came to see me. It had been 10 years down the line. He was so dizzy. He was having spells all the time. He couldn't even find his way home from work. And he told me he had this history of Lyme disease. So I said, why don't we just try treating the Lyme disease? Maybe this is persistent Lyme. And I treated him, and his deaf ear basically came back. Cool. And that's really unheard of. Like, that's kind of in the realm of miracle medicine.
What kind of treatment did you use?
I just treated him with doxycycline.
Okay.
For a
period of time or a long period of time?
I treated him for probably 2-3 months, but after about 3 or 4 weeks in, his hearing just came back. His dizziness went away, and that was it. And I've had several people like that. So if I have a patient who has typical Meniere spells, and if my index of suspicion is that they could have Lyme, whether they have a positive Lyme test or not, I will treat them for Lyme disease. Now, I may use herbs, I may use antibiotics. It just depends on what the person is interested in doing. But it can be a big game changer. I think I'm the only ENT that does that. But it's
interesting. I've really been enjoying this discussion, but I'd like to take a minute to tell you about a new product that I'm very excited about. I'd like to tell you about a new wearable called the Apollo. And this is a device that can be worn on the wrist or the ankle. and it uses vibrations to stimulate your parasympathetic nervous system. And this device has amazing benefits in terms of getting you out of that stressed out sympathetic nervous system and stimulating the parasympathetic nervous system. It has a number of different functions, especially helping you to relax, to focus, to concentrate, to get into a deeper meditative state, even to help you sleep. And there's even a mode to help you wake up. And this all occurs through the scientific use of subtle vibrations. For those of you who might be interested in getting the Apollo for yourself to help you reset your nervous system, go to apolloneuro.com and use the affiliate code Weitz10. That's my last name, WEITZ 10. And now back to the discussion. I saw a few articles that link abnormal glucose and insulin metabolism. With
that's Ken Brookler, right? That's Ken Brookler's work.
And apparently the inner ear is rich in insulin receptors.
Right. Yeah. So Ken Brookler, who's retired now, he's just a really brilliant guy, and he kind of took. Once again, he was sort of a lone warrior out there with this treating people for insulin resistance, and he was also using it for some people. He was using bisphosphonates actually, because he felt a lot of people who had vertigo and tinnitus had what he called inner ear otosclerosis. Which
a loss of bone in the inner ear,
right, a bony overgrowth sort of. It's a complicated condition, but in any case, he had a lot of success, but nobody has actually taken up that mantle. So there's not anybody out there doing that work anymore in my specialty.
What about some of the natural treatments for vertigo and Meniere's? I understand that glutathione may be effective.
That's a good question. I have never used. I mean, I use a lot of glutathione, both orally and intravenously. When I first started using glutathione, I started using it in patients that had what's called sudden sensorineural hearing loss, which can be Meniere's or hydrops. You can just have the hearing loss portion of it, but not the vertigo portion of it. It's complicated, but I started using intravenous glutathione on those people. Personally, I didn't find people had much of a benefit from it. The one thing that you can do for the sudden hearing loss aspect is hyperbaric oxygen.
Okay. You find that to be effective. I also saw a few articles about vitamin D, CoQ10, and ginkgo.
Mostly that's for tinnitus. I've not seen that for.
Okay.
I'll put that. There is this product called lipoflavonoids that people use. You can get it at the regular pharmacy.
Right. Yes, I've had patients get prescribed that.
People will use that for Meniere's. They'll use it for tinnitus. The research on it is not that great, but people try it, and it does help some people. So, you take what you can get.
Now, how often have you seen cervical manipulation be of benefit?
For vertigo?
Yeah.
It can be. There is a condition called cervical vertigo, and the spells can be very similar to BPPV-like spells. Now, so why can the neck cause vertigo? There are 3 legs to the balance stool that keep it upright. Okay. One of them is your inner ear. One of them is your eyes. And the other is your proprioceptive fibers. There are your proprioceptive fibers in your muscles. And for people that aren't familiar with that term, proprioceptive fibers are these small fibers that are in all of your muscles that inform the brain where it is in space. And if you have inflammation in muscles, particularly in your neck, that are getting the proprioceptive fibers to mistrigger, once again, they will misfire and give the brain misinformation. And that can cause vertigo. So whether it's directly a subluxation in the neck that's causing the vertigo, or whether it's the fact that the nerve impulse to the muscle groups is what the issue is, that's then developing these trigger points, I'm not sure, but it definitely can help. And I'm sure in your experience, you found it to be helpful.
Yes, we have. When I was looking at some of the possible triggers, root causes of vertigo, I also saw that heavy metal toxicity can play a role, and it can also be a side effect of a whole series of prescribed medications.
Oh, yeah. I mean, yeah, many medications have some kind of toxicity to the inner ear, and absolutely. And heavy metals are neurotoxic, and certainly if you have heavy metal issues, people can have balance disturbance. And I will sometimes look for heavy metal issues in patients that are chronically dizzy. Which
of the medications do you find are most at fault? I noticed antibiotics.
Right. Minocycline particularly.
Yeah.
Of the tetracycline, doxycycline family, minocycline is the one that I find the most problematic for vertigo.
I also saw blood pressure meds, statins, NSAIDs.
I mean, it's everywhere. It's listed. If you look at the side effects of every medication, vertigo is almost one of them.
Right. Okay. So let's move on to tinnitus or tinnitus. Which is the correct pronunciation?
Both are correct, actually.
Okay. So what's your definition of it?
It's the hearing. It's the perception of a sound that is, an internal sound in the head or from the ear.
And so what do you think are some of the most common root causes, triggers for tinnitus?
Tinnitus.
Tinnitus.
It's a very common problem, first of all. So it's actually sometimes hard to ascribe a cause because it is so common. And people have it for no apparent reason. And one of the common causes of tinnitus, of course, is hearing loss. So if a person comes complaining of tinnitus or it's new onset, I get a hearing test. It's important to do that. Sometimes if it's a hearing loss in one ear, then you should evaluate that in a certain kind of a way. So a hearing test is always a good thing to get if tinnitus is bad or is concerning to somebody. It is in the field of chronic issues, it's one of the toughest nuts to crack, quite frankly. The medications can cause tinnitus. Herbs and supplements can cause tinnitus. Particularly, many herbs have salicylates in them. So like willow, feverfew, they have salicylates in them. If you're taking them in higher dose, salicylates is the base of what aspirin. Aspirin can cause tinnitus. So it's important to note that even if you're taking herbs, they can have side effects, and you should be aware of that. So
herbs other than ones that contain salicylates, or basically?
No, mostly the ones that I know of are the salicylate family, and okay. I don't know all of them, but a lot of herbs do have salicylates in them. So,
what are some of the other common triggers?
Well, noise. So you can, if you go to a loud rock concert or exposed to loud noise, you can be left with tinnitus for a period of time. Usually it's a short period of time. So tinnitus can happen in various ways. Sometimes you just get like a loud piercing sound in your ear. It happens for like 10 seconds and it goes away, and that's the end of it, right? That's tinnitus, but it's not the kind of tinnitus that people go see the doctor for. People go see the doctor because the sound is loud and it's bothering them or they're worried about it being something serious going on. I would say it is possible that any sort of systemic inflammation in the body can support tinnitus happening, but I wouldn't say that if you eliminate all the inflammation by going on all kinds of dietary restrictions, et cetera, you will necessarily help the problem.
Can food sensitivities, can they be triggers?
Like I say, anything could potentially be, but I would never, from my perspective, I see people who have come in to see, have tried a million things and their tinnitus doesn't go away. So the problem is that tinnitus, and if let's say you had tinnitus today, it came on and it can go away in 2 days. It can go away in 1 day. So the natural history of tinnitus in many people is that it's short-lived. So
what percentage of people who get tinnitus have short-lived?
I can't answer that because the people that have that probably I never see, right?
Okay. So, you think it's 20%, 50%?
I think that it's a lot of people.
Okay.
Many people will have tinnitus and they may have it for a week and then it goes away and then they forget about it. They forgot they even had it.
So would you say if you ended up having tinnitus and you give it a couple of weeks and it's not gone?
Yeah, then I probably would look into it a little bit more. But even at 2 weeks, I wouldn't rush into freaking out. And
right. So if you had a patient in the office with tinnitus, how would you work them up? Are there certain tests you would do, or would you just try certain treatments?
I get a hearing test, and then there are certain kinds. Another thing that will cause tinnitus is TMD, by the way, temporomandibular joint disorder.
Oh, okay.
People who grind.
Interesting.
So there is a small percentage, like say 10 to 15% of people have something called somatic tinnitus.
Okay. What is that?
And somatic tinnitus is there is something going on once again in the proprioceptive fibers or some fibers in the neck, and there is this paper from Japan from many years ago, which actually explains the whole neural pathways of how it happens. But there is this path where muscles in the neck can generate tinnitus. And so I do some manual therapy, releasing trigger points, and particularly paying very close attention to the suboccipital area.
Okay.
So, opening up the suboccipital. So many people, because we're in front of the computer all day long, because of how we live,
it's head posture.
Right. The junction between the occiput and the cervical spine is compressed, and freeing that up can actually really make a big difference in some people with tinnitus. If you want to get blood work, you can, and you can look for B12 levels, CoQ10 levels, vitamin D3 levels, or you can just supplement with B12 and D3 and CoQ10.
I saw several papers on the use of pine bark extract, also known as pycnogenol, which was shown to increase cochlear blood flow and eliminate tinnitus in a percentage of patients.
I'm not familiar with that, actually. Maybe I was at one point, but I don't use that on a regular basis, so I don't have enough experience with it.
And what about other supplements like?
Well, so one of the things that I've been using, there is a compounded natural product called Synapsin. It was developed by this pharmacist named Jim Lavallee, who's always.
Oh yeah, I had him on the podcast a month ago.
Right, so he's quite a brilliant guy.
He is, yeah.
And he came up with this product called Synapsin, which is RG3 from ginseng, which is the most potent part of the ginseng plant, which reduces brain inflammation. Nicotinamide riboside and methylcobalamin. Now, nicotinamide riboside as a supplement has been shown to protect the inner ear from noise trauma.
Oh, interesting.
And as has N-acetylcysteine, NAC. Both of those supplements will protect the ear from noise trauma.
Interesting.
So I have, in a number of tinnitus patients, prescribed the Synapsin nasal spray. It's expensive. You have to prescribe it. It's compounded from a compounding pharmacy, but it reduces brain inflammation. And I have had some people where it helps. Not everybody. Once again, not everybody's helped by any one thing in tinnitus, but you take what you can get. If it helps, great. And if it doesn't, no harm, no foul.
And so it's a nasal spray?
It's a nasal spray, right? So,
this is something for sure. This is something that would only be available through an MD prescription.
I'm not sure whether it depends on what the prescribing laws are in the states.
Right. Okay.
The state you're in. But there will be. I know that there are a lot of integrative doctors and Lyme doctors that use Synapsin all the time. It improves mental clarity. It's great for brain fog. I use it in some people for anosmia.
Okay.
And so it's a great product. So I will prescribe the other supplements too. People ask me often about acupuncture, and acupuncture, there has never been a paper out there that's shown that acupuncture has done anything for tinnitus. So I don't generally recommend it, but I have a colleague who's a neuro-otologist, and he does a lot of, complex inner ear surgery and middle ear surgery. He says that he believes that acupuncture helps 50% of his patients. And so, if somebody wants to do it, I would never tell you not to, but I wouldn't go with the expectation that it would. So
I also saw at least one paper using zinc.
I've seen that. I have not seen that it's been particularly helpful.
Okay.
In my experience, zinc has the side effect of nausea. A lot of people don't tolerate it very well.
And then ginkgo?
I've used ginkgo, and there is this product called Arch's Tinnitus Relief Formula, which is available online. And it's high-dose ginkgo. And they say that it's very, very helpful. And for people that are really having a lot of problems, I will prescribe it. It's not a prescription. You just go online and you order it. They have their Arch's Tinnitus Relief Formula. Then they have a zinc product, and they have something else. I just tell people to get the basic one with ginkgo in it. It's what
would be interesting is, since so many people, I don't know what the number is, but I know all my patients, and I think quite a number of people are taking additional supplemental zinc as part of their immune strengthening protocols in the last year.
Right.
I wonder if that has affected rates of
tinnitus. Good question.
Yeah.
Good question. So I will recommend Arch's Tinnitus Relief Formula for people. The people that are most struggling with tinnitus are people that have depression, actually. The natural course of tinnitus is that most people habituate to it. So if you develop tinnitus and you have it for a little bit of time, over time, you'll not notice it. And when you've habituated to it and you're not noticing it, the question is, do you even have it? If you're not even right.
Because it's free fall in the forest. Yeah.
Right. Exactly. So, you're, I have tinnitus, and it's been surprisingly not annoying for a long time. And actually of late, I've just been tuning in and it's hardly there. So, so the question is, for the person that's really struggling, what are the strategies to work with? Antidepressant medication does not really particularly work. So I treat tinnitus like a pain syndrome. So what do you do with somebody who's got chronic pain? how can you manage that non-pharmacologically? Because obviously, pain medications don't do anything for tinnitus. But it's like you can't run away from it. The issue with tinnitus is that it's in you and you can't get it to go away and you can't run away from it. So how can you embrace it? If you can embrace it and not run away from it, the strategy is to hold it with loving kindness and not push it out. That can actually make a really big difference in tolerability, because the key for the person that's really suffering with tinnitus is they're experiencing something absolutely intolerable in their life. So it's how to hold space for what's intolerable. There is a really great book that I recommend to people. It's called The Path is Everywhere by Matt Licotta. And it's all about holding space for intolerable feelings. And tinnitus in that regard can be in that realm of feeling, because it's all the stuff that it brings up. What it brings up in people is the idea, what if this never goes away? How am I going to I'm never going to have quiet again in my life, blah, blah, blah. You have all these stories that you tell yourself. And those are things that make it more and more intolerable.
Okay, great. I think that's a wrap, Doc. You provided us with some interesting, useful information in the realm of ear, nose, and throat disorders, specifically vertigo and tinnitus. How can our listeners and viewers get a hold of you?
They can call my office. My office number is 212-223-4225. And I have a website. My website is asherent.com. And I do telemedicine. So if people want to get a consult from not in the New York area, I do that all the time.
That'd be great. Thank you so much, Doc.
Okay, Dr. Weitz, nice to meet you on virtually, and thanks for your great questions.
Excellent. Thank you. Thank you, listeners, for making it all the way through this episode of the Rational Wellness Podcast. Please take a few minutes and go to Apple Podcasts and give us a 5-star ratings and review. That would really help us so more people can find us in their listing of health podcasts. I'd also like to let everybody know that I now have a few openings for new clients for nutritional consultations. If you're interested, please call my office in Santa Monica at 310-395-3111. That's 310-395-3111. And take one of the few openings we have now for a individual consultation for nutrition with Dr. Ben Weitz. Thank you, and see you next week.